Good evening, everyone. It's 10 p.m. and we have some quiz lined up for you. This is in the subject anatomy. Every night from 10 p.m. to 11 p.m. you have this very interesting quiz that covers not just clinical anatomy but various other aspects as well. Because clinical anatomy is for those who have attempted the MCQs before, the medium difficulty MCQs and other MCQs that are relevant to the gross anatomy. But for those who have not, then the clinical scenario based ones becomes very difficult. So here is a mixed bag. So where you have some of the clinical cases, some of the other gross anatomy questions, everything is mixed up today. It's little different. So here I am, Dr. Rohini, and you have known me very well. I have about 10 years of experience, and that is teaching India abroad, and I'm a postgraduate from Mahe Manipal Academy of Higher Education. It has this college, Kasturba Medical College. So I studied there, and then you can bank on me. I can guide you. I'm your educator for anatomy. I can guide you, reach your goals. You can follow me at ROHAQUA, and my code is ROHINI. This is the promo code which you can use for availing discounts of about 10% and above. So it's very important that your codes also is pocket friendly. Okay, let's see. All right, do we have any questions from anyone? Okay, next one. This topic is quiz up. It is a little different, like I said. It was just clinical based, scenario based questions. Now, clinical based, of course, it is there, but there is a lot of gross anatomy as well. So you'll not just, understand the clinical based questions, but you will also learn the gross anatomy part of it. So let's start with the quiz up. Before that, there are a little bit information that I want to give you. So this is the quiz up. Kindly download the app, go to the Google Store. You can also check out the App Store if you have an iPhone. Go to NEET PG section where you can find all the educators, top educators, and look for my name. Mine is ROHAQUA. You can find me under this. Presently, I'm taking classes at YouTube. That is at 7 p.m. and 10 p.m. This is the topic. Today we discuss the topic bone histology, and then 10 p.m. here we have MCQs. It's going to be really interesting, MCQs. And then that is on YouTube. So you can use this code, whatever I was just mentioning, ROHINI. My name itself is the code. So don't forget the name. And then you have special classes that I have it in the morning, that is at 8 a.m., where you're fresh and ready to grasp for a new topic. That is at 8 a.m. And these are the schedule. And the later on, end of this month, that is mid-month, I can say, that is on the weekends, that is 19th. And yes, it is on 19th, 20th. And then 26th, 27th, and also on 22nd. This will be 29th. That is Tuesday. All this is going to be plus classes. So I'm going to discuss a lot of things in this plus classes. Most of the questions that is relevant to anatomy will be discussed. Good topics will be picked from neuroanatomy, embryology, and all these are the topics which are much needed for your NEET PG. So don't miss these dates, that is 19th, 20th, 26th, 27th, that is weekends, and then also 29th, which is a Tuesday from 6 p.m. to 8 p.m. So it is going to be 2 hour session actually. So it's going to be a 2 hour session where you are going to learn something and also you learn how to attempt. So this is 2 hour session. Don't miss this. And let's move on to the next slide. Yeah, here we have. So now here, you must remember is more than 10 years of experience is what makes an educator connect with the fellow students. So I have about 10 years of experience and I believe I can guide you really well. So here we have, this is my YouTube special classes code, that is ROHINI, and then YouTube, you can go for this code ROHINI. For the special classes, you can look at ROHINI 10. Okay, so there is some limited time offer that you can, think of. That is NEET PG iconic subscription is present. That is 36 months of subscription, and that it was 92,000 before. You can get it for just 58,500. And there is 24 months, that was for 77. You can get it just for 49,500 now. And 18-month subscription, if you think you're very close to the date of the exam, then think which subscription will hold good for you. If you still have a lot of time, then go for the 36-month subscription where you can be thorough in your subject. And then this 18 months, 66,000 will be 45,000 is the amount, final amount. And then 12 months, you are going to get it for 40,500, which was 55 before. So you are going to get a discount of 10% and above. So you can use this code, promo code ROHINI, and you can also avail 10% and above discount. And this is limited time offer for the first come first served, that is first 500 students only. So become one of them and go for the subscription. All right, I have some interesting things here. That is first question. Let's start with the first question. Let's see how many of you are alert and answering now. Yes, Kay, good evening. And then we have Tony, and then we have Tina Snap. All right, so now here I'm going to give you a small task also. That is, we have some promotional things going on. That is for the YouTube. We have a festival that is over the weekend. I would like to interview some of my regular students. So please get in touch with me. You can message me at ROHAQUA. Look for Rohini YN. Under this, kindly message me, Dr. SK. If you can, message, I can tell you exactly what we are looking at. And also Battleground, who is Tony, kindly message me. I want to ask few things, which is promotional videos which I am making. So I would, request you both to get in touch with me so that since you are my regular student, I want to ask you what exactly you're looking at, what is the kind of feedback that you can give. So feedbacks are always welcome, and I would like to get in touch with you. All right, first one. So Tina, who is new, Tina says the answer is C. Let's see, all are true regarding the axillary artery except which one? Except which one? Now we have to find the wrong answer, right? It's a continuation of subclavian. Is it correct? Yes. It is crossed by pectoralis minor. Yes. It extends from the outer border of the second rib. Is this the answer? No, it is the first rib. So here I had a lot of requests and messages coming from students who requested me to keep the MCQs which are also targeting the students who have just joined and who are not used to the clinical based or scenario based questions. They don't have so much of exposure to those kind of questions. So they want to revise the theory part a lot. So that's why, hence, to make an attempt to target that group of people, today I have changed the format, and more of clinical is not there. It is more of the gross anatomy. So for those who have already attempted such questions, it will be very easy. Okay. So first trip, yes, the answer is C. You have to find the incorrect one. The second part of axillary artery is posterior to pectoralis minor. So you remember, this pectoralis minor divides the artery. So you have this pectoralis major, minor. Okay, so this divides the artery, and you can see this one, it extends from here, and see the relation of the median nerve. What is this nerve? The median nerve with the artery, that is the subclavian artery and the axillary artery. How closely it is related to the axillary artery. Okay, Rishabh says C, and then Tina says first rib. Suman, yes. Yes. Next one. Which of the following muscle is supplied by anterior division of mandibular nerve? Who knows this part of the theory? Mandibular nerve. Which of the following muscle is supplied by anterior division of mandibular nerve? Mandibular nerve exits out from which foramen? Foramen ovale. Then it has a trunk. Then there is anterior and posterior divisions. Tina says A. Anterior division of mandibular nerve. Second one, yes, it is always nice if you put the question number. Second one is D. Anterior belly of digastric. So anterior division is all which kind of muscles do they supply? It's all muscular branches. Sensory branches. If you're still confused, I can tell you one thing. Remember P, I would not talk this way, but I had, you know, someone give me this idea. Pakistan, it's a very sensitive area or a very sensory area, and there is Ali there, ALI, Ali. So this is auriculo temporal nerve, lingual, inferior alveolar. Now tell me, what is the answer? The trunk has two divisions. Nerve 2, mylohyoid, and okay, we'll move to the question answers. The answer is lateral pterygoid. Why B? No one told me the answer right. Nobody told me the answer right. Why? Because all those muscles, what we were talking was the muscles of mastication. Lateral pterygoid is a muscle of mastication. What is the supply of anterior belly of digastric? Anterior belly of digastric is also supplied by nerve 2, mylohyoid. This is also mylohyoid. This is also. So this is from the trunk actually. Now to medial pterygoid. So let's see the answer. This is the mandibular nerve. Can you see the otic ganglion? How topographically it is related to the mandibular nerve. This is otic ganglion, and you can see that the topographic relation of the. Yes, Tina says she's confused between medial and lateral pterygoid muscle. Yes, lateral pterygoid is the one which is supplied by, as one of the muscles of mastication, it supplies. And the other one, medial pterygoid, is also supplied by the mandibular nerve, but it's not from anterior branch. It is from the trunk. I'll show you the picture. Now, this is the otic ganglion, and this is the trigeminal. You can see the branches. You can see the mandibular nerve. Okay, this is the mandibular nerve. And then you can also see the other branches that it gives. All these are the branches. You can see now to mylohyoid, to digastric, and all the other things, how it joins with the lingual, the chorda tympani, how it joins with the lingual. All this you can see. All right, we'll go to the answer. So here the answer is actually the trunk gives two divisions. One is meningeal branch. The other one is nerve to medial pterygoid. Then it divides into anterior and posterior. The anterior gives all muscular branches. To which ones? To the temporalis, to the lateral pterygoid, and the masseter. Okay. Out of the 4 muscles of mastication, the anterior division supplies only 3. I hope Tina is with me and she's listening. Out of the 4 muscles, the 3 are supplied by anterior division. 1 is supplied by the trunk itself. Okay, not the anterior division. That's why when you picked the medial pterygoid is not the answer, because it is supplied by the trunk, not by the anterior division. I hope all of you are with me and listening. And posterior division is all sensory, which I already mentioned. So we are not talking about this. It also has one sensory branch, that is buccal to buccinator. Okay, that is a buccal branch to the area around the buccinator muscle on the skin. Buccal branch is to the skin of the area around buccinator muscle. All right, so that is the answer. Next, we'll go to the third one. Regarding ansa cervicalis, all are true except which one? All are true except which one? The superior root is continuation of descending part of hypoglossal. The inferior root is derived from 4th cervical spinal nerve. It supplies sternohyoid, lies embedded in the anterior wall of carotid sheath. So now let's go one by one. It is superior root is continuation of descending part of hypoglossal nerve. Is it correct? Inferior root is derived from 4th cervical spinal nerve. Is it correct? Okay. Now SK says the answer is B. Supplies sternohyoid, lies embedded in the anterior wall. So let's see if it is 3B. Yes, the answer is correct. It is 3B. So look at this. There is hypoglossal nerve and there is also the C1. The C1 and hypoglossal join together to form the superior root. Okay. Then you have this inferior root that is from C to C3 that they join together to form the descending root. And then you can see that the sternohyoid is also supplied by the loop that is formed. So that is also correct. So this is the answer. You can see all these muscles, the sternothyroid and inferior belly of omohyoid. All this is supplied by superior belly of omohyoid. All these are supplied by the ansa cervicalis. Okay, let's go to the next one. The answer is correct, 3B. Fourth one, roof of the fourth ventricle is formed by all of the following except fourth ventricle. There is superior medullary velum, there is inferior medullary velum, or I can show it like this. This is superior, this is inferior. What is this? What is the answer? Fourth one. Roof is formed by which one? Median eminence, obex. This is superior medullary velum. This is inferior medullary velum. Tina says it is 4C and no 4D, and SK says 4C. And Tina says it is 4. Okay, everyone has a different answer. It is not in, no one has picked inferior, but everyone has gone with these three. The answer is median eminence. Okay, so the answer is median eminence. See, this is the superior medullary velum and inferior one. And where is the roof? This is the roof. This portion is the roof. This is the floor. This is floor. This is the roof. So this is nothing but the median eminence. Okay, the floor is also known as rhomboid fossa. Which has got two triangles. That is called vagal triangle and hypoglossal triangle. Yes, rhomboid fossa, and inside the fossa you have these two triangles. So this is the floor where there is pons. This portion is the floor and the opposite end is the roof. Okay, next one we'll talk about neuroanatomy. More of neuroanatomy questions I'm going to bring up. Next, the branch arising from the median trunk of mandibular nerve is, median trunk of mandibular nerve is, or the main trunk of the mandibular nerve. So since I explained the mandibular nerve already, I think you should be able to get it. Branch arising from main trunk. I showed you two nerves arising from the main trunk. Which are they? One was the one which gave meningeal branch. Meningeal branch comes out of the foramen ovale, and then there is absolutely no meninges for it to supply. So it goes back into the cranial cavity through foramen spinosum. So it comes out of foramen ovale, and then there is behind ovale spinosum, and again it will go back through spinosum into the cranial cavity. So this is what happens. It goes in the detour. It takes a tour backwards. So that is gone. Now what is the other branch that is left? A. Now nobody will miss it because it is nerve to medial pterygoid. I said out of the four muscles, 4 muscles of mastication. One is from the trunk, that is nerve to medial pterygoid. So not this, not this, not this. This is from the anterior division. This is from the posterior. This is from the trunk. Okay, Tina. Nice. Next one. So this is how the same picture is present, and you can see the branches, and you can also see the beautiful mastoid process, right? With all those porous appearance of the bone. Shane also says, yay, but yeah, a little slow, but you are there. Okay, next one. Anterior wall of the third ventricle is formed by. Anterior wall of third ventricle is formed by. Third ventricle. So think where it is exactly. It's not near the cerebellum. Where is third ventricle? Third ventricle is near the thalamus, hypothalamus area. So anterior wall, there is anterior wall, posterior wall, and there is the medial wall. D, many think it is D. Okay, it could be. Pineal body, and many of them are always confused between which one is pineal body, which one is mammillary body. Pineal body is where is mammillary body? So many people think it is okay, Tina thinks it is A, and Suman thinks it is D. SK is A again. Okay, let's go to the answer itself. Laminar Terminalis. Okay, the answer is Laminar Terminalis. It is A. So you can see the third ventricle. So now here you can see all these, this diagram, particular diagram is not giving you so much information. So, but the anterior is forward and this is posterior, and you can see whatever you can see here, this is the lamina terminalis. Okay, this is anterior. So now I wish there was markings or the labeling on this. It is not there. And you can see the aqueduct of Sylvius also here. And what is this one? This is lateral ventricle. Lateral ventricle has got body and the inferior horn, superior horn. All this you can see in the lateral ventricle. Okay, we'll move to the next one, seventh one. Which of the following is true regarding the lateral geniculate body? Lateral geniculate body, which one is true? So think, lateral geniculate body is for which? There are two, pathways involving the lateral geniculate body and lateral lemniscus. Which one is it? Lateral geniculate body, which pathway I'm talking about? Anybody who knows which pathway I'm talking about? It is connected to inferior colliculus. That's the first question. Layers 1, 4, 6 receive the contralateral optic fibers. Next, it is situated posterolateral to medial geniculate body. It is overlapped by lateral part of the temporal lobe. Now, anyone, if you can identify which pathway it is, then it is easy. Then we can eliminate either this or this, because temporal bone, you have which pathway? You have auditory. And optic fibers, this will be visual. One of the two we can remove. The answer is B. It is the layers 1, 4, 6 receive the contralateral optic fibers. So you know this optic tract, it involves the lateral geniculate body, and then yes. So how does it pass? To which layer? Which numbers it passes? It passes to 18 and 19, right? This is the visual area. In which lobe? Occipital. Okay. So this is how you can see the optic tract that is formed. And see the medial geniculate body, lateral geniculate body you can see. And see where exactly it is, how it is related. Next one. All are true regarding the femoral artery except. Now all are true regarding the femoral artery except which one? Femoral artery is a continuation of external iliac artery. External iliac artery. Yes, SK, it's a nice question. It's a continuation of external iliac artery. Now, which one is not correct? You have to pick the one which is not correct. It leaves the femoral triangle by passing through adductor canal. Does it pass? Yes, because it goes to the posterior compartment, to the popliteal fossa. So it passes through the adductor canal. This is a correct one. So we don't touch this. Femoral nerve is lateral. So in the femoral triangle, you have femoral nerve which is lateral most. What are the contents of the femoral sheath? If this is the sartorius, if this is the adductor, this is the sartorius. Medial border, medial border. So medial most is what? Medial most one is lymphatics. Then in the middle compartment, what do we have? We have the vein, then we have the artery. The nerve is the lateral most outside. So now here we have the femoral nerve is lateral to the upper part of femoral artery in the femoral triangle. Okay, so now femoral branch of genitofemoral nerve is lateral to upper part of femoral artery within the femoral sheath. Is it inside the femoral sheath? Nerve is not a content. Yes, it's outside. Medial cutaneous nerve of thigh crosses the artery from medial to lateral side near the apex of the femoral triangle. Now, which one is not correct? Rest of them are correct. The answer is like this. The answer is D, because rest of them are correct. The medial cutaneous nerve of the thigh crosses. See, it is medial cutaneous nerve. Why it will cross from medial to lateral side? Why it should go to lateral side? It is a medial cutaneous nerve. It will stay on the medial side. Why it should go to lateral side? So the answer is wrong there. Okay. So rest of the things are correct statements except this one where it says it crosses from medial to lateral side. So that means they're saying it supplies the lateral side, which is not correct. Since the name itself tells you it is medial cutaneous of the thigh, it supplies the adductor compartment. Next one, deep perineal pouch. Deep perineal pouch in males does not include So there is superficial perineal pouch and deep. There is pudendal nerve, sphincter urethrae, long perineal nerve, dorsal nerve of Pelnis. Which one is not a part of deep perineal pouch? So there are a set of muscles which separate this. There is a urogenital diaphragm which separates the superficial from the deep. And the answer is dorsal nerve of penis. So think which one? You think everyone thinks it is the D, pudendal nerve, sphincter urethrae, long perineal nerve, dorsal nerve of penis. Now we have to tell which one not present in the deep perineal pouch, not the one which is present. Everyone thinks it is D. The answer is C. Long perineal nerve. So you can see this muscles which are, separating, or there is istiorectal fossa on either side of the levator ani, and this is filled with fat. And you can see this one, there is a constrictor urethrae. You have this piercing of the urethra. And then you can see corpus cavernosus, bulbocavernosus, istiocavernosus, all these muscles. This is urogenital diaphragm which is separating it. And you can see the piercing of the opening of the sphincter urethra as well, right? So pudendal nerve, obviously it is there because it supplies the external genitalia. That's why it is there. Long perineal nerve, perineum is it down, or perineum is what? What area up to where you call it as perineum? Long perineal nerve, what does it supply? Anyone has an idea? Anybody has an idea? In long perineal nerve, what does it supply? And what are the symptoms? Long perineal nerve, superficial and deep perineal nerve, that is what they're talking about. So this is not a part of this one. There is a mistake in this, and the answer is C. So I hope you all are realizing what I'm talking. Battleground, mobile India. No, ma'am. Okay, for which one you are saying no? Pudendal nerve is correct. Sphincter urethrae is correct. What is long perineal nerve? Is there anything by name long perineal nerve? Is it there? Is it there first of all? Does it exist like that? So it is not present. They're trying to confuse you. So this is not there. So that is the one which does not present or does not belong to deep perineal pouch. Okay, so because that name itself doesn't exist, so there is no point in discussing about something that doesn't exist. Next one. So next question. Which one is true regarding suprarenal gland? Which one is true regarding the suprarenal gland? Suprarenal gland, you also know it is adrenal gland. Adrenal gland. Now, who will tell me what is the proper statement or the correct statement? Posterior surface of left suprarenal is related to kidney. Posterior surface of right suprarenal is related to inferior vena cava. Lateral border of left suprarenal is related to left gastric. Lateral border of right suprarenal is related to right celiac ganglion. Which one you think is true? This is a little tough question because you have to recall the diagram. So which one is true regarding the suprarenal gland? Posterior surface of left suprarenal. Suprarenal is above the kidney. So is it related to the kidney? How it is related to the kidney? Tenth one. SK says it is A. Which is true? Which is true? You have to pick the one which is true. And Nilusha thinks it is D. And Tony says it is D. Okay. All right. The answer is A. Posterior surface of the left suprarenal is related to the kidney. The posterior surface of left suprarenal. It depends on shape of the suprarenal. How is the left suprarenal? What is the shape? What is the shape? Which one is crescent? Which one is pyramid? So the left one is crescent shaped. Left one is crescent shaped. That's why the posterior surface of left suprarenal is related to the kidney. Okay, the left one is crescent shaped. Yes, or semilunar in shape. This is semilunar or crescent, like a moon, half moon. Yes. So right one is pyramid. So because of the shape of the suprarenal gland, the left one is got a posterior surface which is related to the kidney. Next one. All right. Pisiform is a sesamoid bone. And it is found in the tendon of which muscle? It's on which side, first of all? Anybody? On which side is pisiform? Which tendon gets attached to it? D. Abductor digiti minimi flexor carpi. Yes. D. Suman says it is D. Yes, you're right. Your answer is correct. Flexor carpi ulnaris. There is nothing much to discuss because we all know it is ulnaris. 11th one is D. This is the flexor carpi ulnaris, and you can see. And where is the ulnar artery? Is it medial or lateral to flexor carpi ulnaris? Who knows the answer for this? Who knows? Ulnar artery is medial to it or lateral to it. See, remember, the medial is this side, the lateral is this side. Where is it? Lateral is towards the thumb. Where is the ulnar artery? Where should you look for ulnar artery? Okay, Suman, any idea? SK, any idea? Yes, it is lateral. It is lateral. See here. This one is the ulnar artery. It is lateral to. See, this is where it is. So it is lateral to the ulnar artery. It is one thing. Yes, lateral to the tendon. Yes. Yes, Suman, lateral to the tendon. Next, largest bursa in the human body. So there are so many bursae, and there is subacromial, prepatellar, infrapatellar, trochanteric. Which one is the largest bursa? This is one which undergoes frequent bursitis. Subacromial bursa. Because of which one? Which muscle? Anybody? Anyone knows? Which muscle? Which muscle? Which muscle is very close to this subacromial bursa? Supraspinatus, painful arc syndrome, where the person will not be able to lift his arm from 0 to 15 degree. Initial abduction not possible. Okay, deltoid has deltoid bursa. Prepatellar is, what is the clinical thing related to this? Housemaid's knee. The trochanteric bursa in the lower limb. Below the gluteals. Infrapatellar bursa. Supra and infrapatellar, this is around the quadriceps. Okay, so these are the different one. The largest of all of them is subacromial bursa. Okay, so all right. Next one. This is not the okay. Next one. Clergyman knee. Yes, you're right. Infrapatellar clergyman's knee is another clinical aspect we have to look at, which is not a part of hypogastric sheath. Hypogastric. So we are talking about different, thing. Epigastric, hypogastric. What is this? Hypogastric sheath. Transverse cervical ligament, broad ligament, lateral ligament of the bladder, and uterosacral ligament. Anyone? Anybody? What is it? What is this hypogastric sheath, first of all? It's a condensation of transmits the vessels and nerves from the lateral wall to the pelvic viscera. Now with this hint, you tell me, that is hypogastric sheath. So transverse cervical ligament, is it in the cervical ligament? Broad ligament, this is in the uterus. Lateral ligament of bladder, uterosacral. Now, which one is the answer? So the answer here would be, let's see, what broad ligament? Some people think it's broad. Not a part of, not a part of. So you have to think properly. Sanjuna says it is B, broad ligament, and Suman also thinks it is B. So let's see. The answer is B, that is broad ligament. You are right. Now here, it is not a part of hypogastric sheath. Okay, it is broad ligament. It is a part of the uterus. All right, next one. Chief pronator of the forearm. Now, there are so many muscles which do pronation, supination. Pronators are the ones which start with the same name, pronator teres and quadratus. Which one is the chief pronator? That means it's a principal or primary muscle. Which one we can completely eliminate first? You have to eliminate the one which is completely a no-no, and it is something that doesn't belong at all to this. Which one do you think it is? Gravity? You think it's gravity? Pronation, it's gravity. Many of you think it is gravity. Let's see. Why did you think it is gravity? Okay. Both pronation, because in anatomical position, our hand is not pronated. Okay, it is beside the body, but it is not directed or in pronate, not kept in pronation, right? So it is not pronator, gravity. So it is the correct answer is the pronator quadratus. Okay, it is like a watch. This is the one. It's exactly where you wear your watch. So it is this one, correct? Is it this one or is it flexor carpi? So pronator quadratus. You can see many muscles here. Flexor carpi. Ulnaris you can see, flexor digitorum you can see, the others you can see, but where is this pronator quadratus? That pronator quadratus is exactly where there is this place to wear the watch. So quadratus, the name itself tells it is like a rectangle. Next one. Supination of forearm with the elbow extended is brought about mainly by. So supination of forearm. There are two muscles which do supination. That is the biceps and the supinator. Let's see who's answered this. Yes, you have to ignore the one which is completely wrong, doesn't make any sense. Yes, Amal Jos, you have to ignore the one which doesn't make any sense, because supination is brought. Where is supinator, first of all? Is it in extensor compartment or flexor compartment? This is in the extensor compartment muscle, right? So brachialis is something you can ignore because this is in the arm, right? We're talking about elbows, so you ignore that first. So we are left with how many? We are left with 3. Correct? We are left with 1, 2, 3. 1, 2, 3. Now the name itself tells you supinator. So what else do you need? Do you need any other muscle? Supinator, the name itself tells you supinator. So you can just go with the supinator, and 5, 1, 5 is B. Supinator. The other supporting muscle is biceps brachii. It is involved in rapid supination with elbow flexed. Okay. When elbow is extended, Did you know this? How many of you knew? When elbow extended, you have supinator. When elbow is flexed, biceps. Why? It is a flexor muscle. It is not an extensor muscle. What is this? It's an extensor muscle. And this will do work only when elbow is extended. And this will do when elbow is flexed. So if you are hearing this for the first time, you must like and follow. Right? I don't think many of you knew this is the answer. Biceps brachia is present in the flexor compartment and it will work when the elbow is flexed. Supinator is in the extensor compartment and it will work when the elbow is extended. Okay, so please like and follow. Don't forget to hit a like because some of the questions you are hearing for the first time, I'm sure you gained a lot of information with this. And coming to Amal, see next to the title, there is quiz up to clinical anatomy, and next to that there is my name. Next to that there is a drop down. Please click on this. Click on this drop down. There are so many links. Click on this and you can see the link to follow me. One is to follow me. Another one is to subscribe and to use code. Next, you have a Telegram app. Click on this and join. Okay. This is for Amal who just asked me. And there are various links for feedback. You can also have a playlist of all my classes. You can watch the playlist. You can click on that and all my classes, you can get a list. So far, whatever, we have more than 5,000 minutes. So all these things you can views. So all the classes that is conducted so far, you can view it. So make use of the opportunity that is gotten. Join the Telegram. You can also download all these PDF notes by joining because we post a lot of notes and other material relevant to your NEET PG. So join them and I will be stopping right at this. Me, Dr. Rohini, signing off. Don't forget to hit a like and comment. Please follow ROHINI, or you can just look at this ROHAQUA. And kindly Tony and Dr. SK can message me because I'm looking for someone who can give some tips on cracking NEET PG. So we have some interesting things going on. So let's talk to students and find out how they find these classes, what is their feedback, and you can I'll tell you how exactly to communicate with me. Suman also can get in touch with me. And I remember 3 names. If there is anyone else whom I have missed, they can get in touch with me. Kindly message me. This is my user name, ROHAQUA. So message me. I'll get in touch with you shortly. Thank you so much.